Originally, we came to Dr. Linda's office for a second opinion on my daughter's tongue tie. We had been told that she had a tongue tie and were looking to get some more information. We had been managing the symptoms of my daughter's tongue tie for the first year, and my daughter was about a year old when we came for the second opinion, and we ended up having several revisions with Dr. Linda, not just the tongue tie, but a lip tie and some buckle ties. It turns out my daughter needed more help than we knew. The revisions went really, really well, really smoothly. Everything healed great. My daughter is 5 years old now, and she hasn't had any issues with the revisions since then. The very first thing that impressed me about Dr. Linda when I came to have my daughter's tongue tie revised was the way that she treated my daughter as her own child. She calls all of her patients her babies. She held my daughter. She sings to her patients. She sang to my daughter. It's one of the things that caused me to move both of my children's care to Ashburn Children's Dentistry. My oldest child is 8. He has Down syndrome, and it can be very difficult to find a good fit where a provider is understanding and patient and devoted to really giving his population the best care possible. And we really have found that in Dr. Linda. So even though it started with coming for my daughter's tongue tie revision, and it started, with her as an infant, it's become something where the whole family has benefited, because, my son, when we first started, had significant sensory aversions to in-office dental visits and dental care. And when we first started, Dr. Linda and her team gave him time and breaks and attentiveness, and were just really focused on him as a whole person, which again, I think when you're dealing with a child with special needs, finding someone that could care for my son and treat him as a whole person was just invaluable to us as a family. I would recommend Dr. Linda and Ashburn Pediatric Dentistry because it's not just about your child's mouth. It's about the child as a whole, and they treat your child's teeth with the adult that they're going to become in mind. And again, it's not just about their teeth. They're looking at, how is your child breathing? How is your child sleeping? How is your child's nervous system functioning? They're looking at collecting and collaborating with a team of providers that they've curated to give your child the best possible outcome. In today's day and age, medical care can be very specialized, very fragmented, and it's nice to find a place where there is that collaboration, where your child is treated as a whole person, where they're not just looking at one area, even if it's that one area that they specialize in. They're looking at this one area and they're saying, how can we take this thing that we specialize in and expand it so that it benefits the whole person and their whole body? I think that's what really makes Dr. Linda's office special.
My daughter had a lip and tongue tie that was causing severe acid reflux, where she would be up all night kind of choking and gagging. It was a silent reflux, so it was pretty hard to deal with. So while we were here, Dr. Linda kind of took us through the process, thoroughly looked at both her lip and her tongue tie, and then we took a holistic approach to it, seeing if it could be released just with baby lays, and if not, then a release. So we started with baby lays treatments, which saved us because she immediately would relax, her acid reflux got better, and her tongue really gained a lot of mobility even after that first baby lay session. And when I saw such great improvement, we then did a lip and tongue tie release. But because we had done so much preparation, it was like nothing had ever happened. It was very easy, and she has rebounded very quickly from it because her body was ready for it. Everyone is so amazing here. Dr. Linda, I call her a unicorn. So she makes everybody feel happy and welcome and okay. So obviously I'm a first-time mom. I was very nervous about having a daughter who had a lip and tongue tie, which in the grand scheme of things doesn't seem like a big deal. but it felt like one. And just knowing I was in good hands, we came in, she explained everything to us, explained the anatomy and how the tongue tie affects so many different parts of the baby and why certain things happen and what we would see as we progress through the treatment. And she's amazing. The first time we came in, the baby was so unhappy that she actually had a baby lace treatment, and she immediately relaxed and went to sleep. And we had a very tough time for about a week at that point, where she really wasn't sleeping. She was really crying and fussy, and immediately to see that relief in the baby. While Dr. Linda is doing the treatment, she started singing because the baby was screaming because she was just uncomfortable all the time. And she just looked up at her like she was the most magical person in the world. And so I knew right then that I was doing the right thing by seeing Dr. Linda. And then just the staff is incredible. They call, they check in, they make sure everything's great. After the procedure, Dr. Linda gives you her cell phone number, she calls, she checks in. You just don't get that kind of treatment anywhere else with any other doctor. She really cares.
My daughter was having some difficulty with her sleeping and with her anxiety, and then also some difficulties with crowding in her mouth. And so we kind of put all those difficulties together. We started talking about them, and Dr. Linda started asking me about what my daughter's sleep habits were, and did I notice things at night. And these were some things that I wasn't really thinking about ahead of time, other than I knew my daughter was kind of tired when she would wake up. She wasn't feeling fully sort of replenished from her sleep. And so Dr. Linda was helping me to see sort of like her circles under her eyes, and she asked me to do a behavioral assessment of her at nighttime, to kind of go into her room, watch how she was sleeping, the position of her head and her neck and her mouth, and was she breathing through her nose, things like this, all could be assessed. And so then once we did that assessment, I got to come back and talk with her and some other staff members about what difficulties might be happening for her and how we could make some improvements so that we could actually change all of these things at once, help with more room in her mouth, and that would help her with her breathing, and as a result that would help her with her sleeping, and that would also help relieve some of her anxiety. We started with a full comprehensive assessment of my daughter's basically kind of her anatomy, with pictures taken of her face and the positioning of her neck and her head and her jaw. We've had things done like frenectomies for a lip tie and for a tongue tie, and those have helped a lot with my daughter's tongue strength, because I've been learning that the tongue is actually the key to helping with giving more room in the mouth. Like the more that her tongue is on the top of her mouth, the easier it'll be for her to swallow and breathe, and it'll get more room to all of her teeth in her jaws. Those two operations went very well. Both Dr. Crystal, because she did the surgeries, Dr. Crystal, who is Dr. Linda's daughter, and she did the surgeries, and she always followed up with me to make sure that my daughter was recovering well. And then after we've done those two surgeries and we had the recovery period for those, then we have moved to a lot of what's called like myofascial exercises. So my daughter comes every 2 weeks sometimes every 4 weeks, and she learns new exercises to strengthen her tongue and to practice breathing through her nose more often. So she has basically like a coach who teaches her how to do those things. And then we practice them at home at night. And then she also has a device in place called an ELF. It's helping her to increase the size of her palate. The results have been great in terms of what I've noticed is my daughter's teeth that used to be crowding against each other have now, they're all kind of separating into their own spaces, to the point where she had one tooth was really occluding the other one, and now it's moved to here. and it's almost perfectly aligned, and that's without braces, which has been wonderful because I had braces as a kid, and so I was kind of fearful that she would have to have braces for a long time like I did. But we're doing all of this movement now without the help of the braces. What is even neater is that my daughter is noticing that with all the exercises she's been doing, she has greater lung capacity for things like her swimming and her dancing. And that's part of breathing better and having better posture. And I also think from all the rest that she's getting that she wasn't getting before. And so she's got more energy and more lung capacity. So that was a really big deal. And I think one of the things that I've noticed, and I'm a therapist, so I pay attention to this kind of thing in my daily professional life, is I've noticed her have less anxiety about quite a few things, but trying new things, especially trying new foods, less anxiety about school and academics, and more of a feeling of confidence within herself and also with her smile. I would recommend Dr. Crystal for sure for her ability to connect with kids while doing her surgeries, and as well as the follow-up afterwards to make sure that everything is okay. And the reason that we work with Dr. Linda and Dr. Crystal as a team, Dr. Linda is so warm, so knowledgeable, so wonderful with children. She makes you feel like you are well known when you're here. You come in, she welcomes you with a smile. Both she and Dr. Crystal have a way of calming the children when they're either having maybe a dental cleaning or any kind of oral type surgery. They will sing to the kids. It's the most beautiful thing that I have seen in medical practice in terms of connecting with the child and helping the child relax and help them feel much more confident that it's going to be okay and get through it without feeling overly anxious. And so this has just been a wonderful experience for us, and we tell all of our friends and especially other parents with children who have maybe any sleep problems or any anxiety problems, or especially those kids who are needing to have some help with their breathing and their the shape of their mouths, to help them to be able to fit all their teeth better without necessarily having to go right away to braces. So there's a lot of reasons we come and see Dr. Linda and Dr. Crystal. They're a great team.